I'm Vanessa Green, and I bring you greetings from the Grand Rapids African American Health Institute, where I am privileged to serve as the CEO. I want to thank you for joining us as we kick off the celebration of our 20th anniversary. GRAHA was founded in 2002 due to a community-wide survey revealing disturbing disparities in the health outcomes in the African American community. And COVID-19 has amplified these disparities and devastated our community both physically and mentally. And GRAHA has been on the front lines, keeping our community informed and supported during this horrific pandemic. And today we have assembled a powerhouse panel of female leaders who are here to discuss the impact the virus is having on our lives and the workplace. We know that there is power in shared understanding and knowledge. That's why I'm so excited and grateful that these leaders are here with a willingness to share today. So let me introduce them. First, we have Christina Fries-Decker. And Christina is the President and Chief Executive Officer of Spectrum Health System, an $8 billion integrated health system employing 31,000 individuals in Michigan. Tina has developed a track record for cultivating the culture and driving strategy at Spectrum. She is committed to fostering trust within the organization and communities through authentic, transparent communication and building a health system that celebrates and reinforces diversity, equity, and inclusion for team members, patients, and families. Tina has successfully implemented a new vision, mission, and values, resulting in better health outcomes and access, lowering costs, and reducing health inequities. She has received numerous awards and recognitions, being ranked as one of the most notable women in healthcare. Tina earned a Bachelor of Science in Finance from Iowa State University and graduated with a Master of Health Administration and Master of Industrial Engineering from the University of Iowa. Tina, can you wave so that people can see who you are? Thank you. Next, we have Teresa Weatherall Neal. Teresa serves as the President and CEO of Lead 616, a leadership development company where she provides professional development and strategic planning and serves as an instructor and coach for the Michigan Superintendent's Leadership Academy. Teresa recently retired as the Grand Rapids Public Schools Superintendent after serving multiple roles in the district for over 43 years. She served over 18,000 students, over 3,000 employees, and managed an annual budget of over $300 million. Teresa has received 2 honorary doctoral degrees for her leadership in education, one from Grand Valley State University and one from Ferris State University. She has a master's degree in educational leadership from Western Michigan University, Bachelor of Science in Public Administration from Grand Valley State University, and an associate degree from Grand Rapids Community College, as well as a certification in Superintendent's Leadership Academy from Harvard University. Teresa, can you wave so that people can see who you are? Thank you. Next, we have Christina Keller. Christina is the President and CEO of Cascade Engineering. Christina is focused on having a positive impact on society and the environment. Under her leadership, Cascade Engineering is a $370 million anti-racism company employing over 1,300 people globally. Cascade Engineering utilizes an operational excellence framework and is a leader in the circular economy and in the electric vehicle market. Christina is focused on being an innovative employer of choice with the safest, healthiest workforce and a culture of engaged employees. Christina is on the board of directors for Independent Bank, the Economics Club of Michigan, of Grand Rapids, Paragon Dye and Engineering, and the Housing Stability Alliance for Kent County. Christina holds an MBA from the Johnson School at Cornell University and a BA from Boston College. She also holds a certificate in economics from American University and a certificate in Lean Six Sigma Black Belt from Villanova University. Christina, can you wave, please? Thank you. Last but not least, we have Dr. Wanda Lipscomb, who is the Senior Associate Dean of Diversity and Inclusion and the Associate Dean of Student Affairs at the Michigan University College of Human Medicine. She is a tenured associate professor of psychiatry and is the director of the Advanced Baccalaureate Learning Experience ABLE program. The ABLE program has provided the educational pathway for over 300 students from underrepresented, minority, and disadvantaged backgrounds to enter medical school. Dr. Lipscomb has been a successful principal investigator of numerous grants funded by the Health Resources and Services Administration, HRSA, totaling over $22 million that focus on workforce diversity. Dr. Lipscomb is actively involved in national leadership roles with the Association of American Medical Schools. She is the chair of the National Council of Diversity in Health Professions, the past national president of the National Association of Medical Minority Educators, and a past national president of the Association of Multicultural Counseling and Development. Dr. Lipscomb received her BA in mathematics from Lincoln University, her MA in psychology from Washington University, and her PhD in counseling psychology from Michigan State University. And what I like about this panel, beyond all the accomplishments, and I provided a very brief summary of their background and accomplishments, but what I like about them is their authentic, genuine leadership and commitment to serving this community. And with that, we're going to get to what you all are here for, and that is to hear from them and learn from their leadership and ways that they are working to serve the community and their employees during this pandemic. So first of all, I'd like to open up a question for all the panelists regarding the impact of COVID. And so we will start with Christina Keller on this one. Could you tell us how has COVID impacted you, and what would you like the audience to take away from this discussion today?
Thank you so much, Vanessa, for your great introductions for all of us. I'm excited to be on this panel. So I am an extrovert. And so for 2 years now, I've been limiting my exposure to other people, which has been rough on my mental health. I also had childhood asthma, so I was unsure how I might be impacted by a lung-based illness. But I'm pleased to say that at this point in the pandemic, our whole family has been vaccinated and boosted where applicable, so that when my daughter actually unexpectedly got COVID over the holidays, she recovered quickly and fully, and none of us, the rest of us got it So I'm feeling a lot more confident than I did earlier when this was a novel virus with no treatments available. But I'm still experiencing the disruption to our lives, into our businesses, into our supply chain. And so I hope that as the audience is involved in this discussion, that one of the takeaways that people have is that if you haven't been vaccinated, that you do go out and do that, so that as a society we can continue to move past this, and hopefully as it becomes endemic and not a pandemic, that we're able to learn how to live with this in our lives moving forward. So thank you.
Thank you. And next we will have Teresa. If you could answer the same question, how has COVID impacted you, and what would you like the audience to take away from this discussion?
Thank you. So right at the beginning of the pandemic, my grandson's father died within the first 30 days, and he lived in Detroit. And so we have not really had an opportunity to grieve, especially for my grandson, who's 18. So it directly impacted us right in the very beginning. So we took it very seriously. And as soon as we could get the vaccine, we did. We've gotten our booster, everyone in my family. But I think one of the things that it has taught me is how fragile life really is. And because of the inequities in our communities, in the state, in the country, in the world, right, we are seeing a greater impact for people of color, for children living in poverty. And I think that these systems that we have built are also very fragile. Many are collapsing from the weight of this pandemic. And I think that's probably my biggest takeaway. Things that we thought were safe and solid and we knew we had to push through are not safe at all, but very fragile, right? So we need to correct these institutions that we've created.
Oh, thank you for that. Wanda, would you like to go next?
Happy to. I think the last 2 years has taught all of us in higher education, and particularly in the medical education community, that we're not in control of everything. So this pandemic has turned our educational process upside down. It has challenged us to rethink all of our principles. How do we deliver? How do we motivate? How do we engage? Especially much more difficult in medical education, where a part of the engagement is interaction with patients all the time. So I think we all are approaching it from a slightly different perspective. I want to echo Christina and Teresa's comments from a personal standpoint. I have had my vaccine, I was boosted, life was going well. I have a brand new granddaughter who lives in California. We had visited her many times, and over the Christmas holidays, we had crossover COVID. And I want people to understand why vaccines and boosters are so important. I am the poster child for the person who never wants to have COVID. You know, I have every risk factor known. And I was tired. That was my whole response. But I also was well educated. So as soon as I had a diagnosis, I knew to be in contact with healthcare providers. I was able to have an antibody treatment. I had people monitoring all of my symptoms, and it just made a huge difference. So for those of you who think that, oh, I haven't had a vaccine, I won't get a booster because I might have crossover COVID. I never went to a hospital. I'm asthmatic. My lungs didn't shut down. Life was good. I was tired. I probably needed to rest anyway. I do too much. So I think the message is this is going to touch each of us individually. How it touches us and how it touches our families and the people we love is based on how we respond to the education that our healthcare providers give us.
Thank you so much for that. And Tina, can you respond to that question as well?
Thank you very much, Vanessa, for hosting this and having us speak. And it's wonderful to be with Christina, Teresa, and Wanda. And I echo their comments about what we feel. But I'm going to build off of something that Wanda just said, which is how we approach this pandemic can set the tone for our lives. And it can be really easy to be focused on some of the negative things. And we'll probably cover some of those today. The past 2 years, it has not been easy at all. But when I think about COVID, I try to think about what I'm grateful for. And I am extremely grateful for our team of exceptional healthcare workers who every day are doing what they can to care for our community. I'm grateful for the miracles of science, for the vaccine. It's amazing. It's amazing that we have that. I'm grateful for the collaboration that I see in our community every single day. I remember when this first started 2 years ago, and we needed hand sanitizer, and I called people and they said, absolutely, we will make it for you. That came from our community. And there are so many other things that people did to help us. I'm grateful for the trust that people have in us. And that, as Teresa said, is so fragile. It is hard to build it up, and it goes away in an instant. But I think that trust is something that we have to have all the time. And I'm grateful for the compassion and the generosity that we see evident in everyday things. I'd also say that I'm grateful for the innovation. You know, it's easy to stay average or to stay at the status quo, especially during a pandemic when there's so much uncertainty. You just want to stay with what you're doing. But we really felt that our commitment and our mission required us to be exceptional, to push and strive to be something better. And that's why we pushed for more health equity, greater vaccine access, better resources to serve our community, greater educational and community outreach. The list probably goes on, but we really wanted to make a better difference for our community. And I hope that it was felt in some ways that our efforts were to improve health. And I always think that there's always an opportunity to be better than yesterday. And that provides this hope for all of us for a brighter future ahead. So the takeaway that I want to have today from this discussion is how we can be even better, healthier, more warm-hearted, cooperative, courageous, hopeful, and innovative. And I do look forward to this conversation.
Okay, that's great. Thank you. Thank each of you for your heartfelt responses and in speaking from the heart, as well as speaking from some of your personal experiences, because often people see people in certain roles and positions and feel that they're immune from the things that the rest of the community are facing. And so thank you for that. And then so each of you can really segue your comments into the next question. And this question is for Tina and Christina. And Tina, if you don't mind starting on this one, how would you describe the current state of your workforce? You guys have already talked about the power and the sacrifice and the commitment that they have to serving and caring and taking care of the community. So if you could speak on how would you describe the current state of the workforce, what are the greatest challenges that the staff is facing, and what support systems do you have in place for them? So Tina, if you could start first, and then we'll move to Christina Keller.
Thanks. If I could just use one word, I would say exhausted. Our team is exhausted. It's been tough. We continue to stay focused on our mission, and we're learning a lot, and we're innovative. The good thing is we know who we are, we know our purpose, and we know that that purpose has never been more clear or compelling right now. But it is a very challenging time that we are navigating. It feels like we're, just like many of you, running this 2-year-long marathon, and we still haven't seen the mile marker yet to let us know when it's over. And I'm hopeful that it will be to an endemic at some point. We're seeing chronic burnout. We're seeing early retirements and moral duress. We continuously share our thanks with our care team, the providers, the nurses, the respiratory therapists, the environmental services workers, the food services, so many people. It takes so many people to care for our community, and I'm grateful for all of them. We've been putting a lot of things in place to help our team assist with the burnout, with the trauma and the experiences that they are going through. We've had this before, but we've continued to elevate it and invest even more for our team members. We have critical incident stress management services. We call it CISM, which offers a safe space for our team members to heal after a traumatic event. So we hold these type of events when there is a death, when there is a safety event, or if there's something that didn't happen in the hospitals but has impacted our staff, where we come together and we talk about it in a safe place so that we can at least have the conversation. We also have an employee assistance program that we've expanded and refined and pivoted the services to go well beyond the standard counseling services. And we've offered care.com resources such as childcare and elder care, as well as Headspace. And some of those are funded by our foundation, which we're grateful for, because now our team members can have access, for example, to Headspace, where you can turn to that app for everyday mindfulness. I'd say one of the biggest challenges facing our team right now is the increase in violence and the demand for a non-evidence-based care. There is a significant amount of disrespect, distrust, and disregard for our team members, and I'd probably say it's at an all-time high. You may think that doesn't make sense. How can that be? But it is, and I think it happens before the pandemic, but we shouldn't tolerate it before the pandemic, and we shouldn't tolerate it now. Many times people come into our hospitals or to visit the physicians, and sometimes it's for a happy reason. They're having a child, they're grateful for surviving cancer. But we also know there are a number of times when people come in and they're anxious, they're nervous, they're sad, they're angry, they're frustrated, and they're worried. We take care of a lot of people. And so it's only natural that those tensions and that stress gets released, and it gets released on our team, but it doesn't make it right. So this is an area where we really need some help, because we need to have as part of our community that it isn't okay to be disrespectful to our care team members. It's not okay to be disrespectful to anybody, but we need to figure that out, and we need to come together as a community to commit to solve this, to commit to support all of the people in our community who are trying to do their very best to take care of us, whether they're in healthcare or somewhere else. I think we'd love to have more respect and patience. We need to recognize that we are all different, that we all live unique, individualistic lives, but we're all so connected. We're so dependent on each other to be healthier and to be happier and to live those better lives. So it's extending grace. It's having that more trust and respect, and remember that we are all in this together still. And so those are my comments about where our team is and the biggest challenges, Vanessa.
Yeah, thank you so much. I appreciate that. And I can tell you, in the position that I'm in the relationships with the community, I hear those stories quite often. So I really appreciate you sharing that. And I'd love to come back and talk about that more. You indicated that, that the health community needs help with that. And I think that collectively as a community, there are ways that we all can come together and better understand and better support the needs on all aspects and all levels. So appreciate you sharing that. Christina Keller, can you add to that, please?
Absolutely. And Tina, I think you're so right to point out that when people are challenged, you often have the worst come out of yourself. And I think that even with this isolated society that we're living in now, it's harder to have a collective humanity, and it's easier to almost lose faith in the goodness of others. So I think that's an important challenge. And I would echo what you were saying as well, that the biggest challenge that our team is facing as essential workers is fatigue. At this point in the pandemic, it's 2 years of navigating changing landscapes, supply chain shortages, and overtime, supply disruptions, everything that we're having to deal, and also policy changes. So trying to change, we've worked and created workarounds on how we do our town hall meetings, our award celebrations, our shift meetings, our mission rooms, eliminating outside visitors, customers and contractors where feasible, updating our remote work policies. So there's been lots of change for people. And I know that people deal with change differently. And I know that at 2-year mark, constant change can be very fatiguing. So we're seeing that, people are tired, and that mental health is suffering. And so we have worked with the employee assistance programs with Pine Rest, that help with work-life stressors, family issues, financial concerns, and all of our family members have a free up to 5 visits with that. And appointments can be in person or with online telehealth as needed. And we find that that's helpful. And I think I just want to, I know Kenyatta Brame and Sharon Darby are on the call. And I in the vein of gratitude, I'm so grateful to have these individuals in our organization, keeping up to date on the changing landscape and the changing regulations, and keeping us on the forefront of what we need to do, and also on the forefront of communication to our employees, because I think that people are understanding that things are changing, and that we don't even know sometimes what's going to happen tomorrow, but we're trying to create an open dialogue. I often try to think about the triple bottom line as our compass. So when we're confronted with a new issue, how does this impact our people? How does this impact the environment? How does this impact our profitability? And just make the next best step. Sometimes you can't be in long-term mode when you're dealing with crisis. You have to just look at what is the next best step based on the facts that I have today, and make that step. And with excellent wayfinders like Kenyatta and Sharon, we've just been navigating through and helping our team members with fatigue, and remembering that sometimes it's the smallest things, a 2-word thank you note, just to comment somebody to say, great job. That means so much to people right now, because right now people are struggling, and you may not see it in how they're presenting. You may not see it in a lot of different things. I think for a lot of us that have been working on issues of anti-racism or servant leadership or other things, people are tired in general. And so those little things that you can do to just lift others up can be very powerful right now.
That's great. Thank you, Christina. So I'm going to shift to Dr. Lipscomb. Dr. Lipscomb, can you also talk about the biggest challenges that medical school students are facing, and the residents that you're working with, and the kinds of assistance that you all are providing them?
So happy to respond to that. I think for our medical students, even without a pandemic, they have to live in 2 worlds. They're learners. So, they have to be committed to being the finest students they can. They're with us for actually a relatively short period of time. 4 years goes by very, very quickly. At the same time, they become a part of the care team. And so when they are rotating through the services at Spectrum, they're a part of that care team with the residents, with the attending physicians. And so even pre-pandemic, medical students had to think about living in 2 worlds. Since COVID and everything got turned upside down, their mental health has been super challenged. So I'll just speak to this from a Michigan State University standpoint. So while every student at Michigan State University today is learning remotely, that is not how the medical students are learning, because we are always in the asterisk mark. And so our students are still in simulations, and they are still in labs, and they're still rotating in the clerkships, and they're still in clinics. And so this is an ongoing challenge for us to keep them motivated, to keep them positive, and to have them understand that they do live in those 2 worlds. They're being educated. They must be astute. They must be focused. They must complete assignments on time, turn in papers, do all the things they had to do pre-pandemic, and also for them to appreciate this phenomenal opportunity that they have to be a part of dedicated care teams. You know, it is learning on the job. It is being there. So in the course of this pandemic, we have had to shuffle many, many things. In 2020, when all of us went home the third week in March, with the idea that we were going to be away from the university for about a month, it took a major sort of rethinking about what we were going to do with the medical students who were on all those rotations. And the national conversation shifted, and medical students were pulled out of those clinical rotations. And then we had to figure out how to get them back in. And so I think one of the things that we're proudest of is the fact that we were able to work so closely with our hospital partners and the healthcare system to get our medical students back in May of that year. We figured it out. We figured out what the rotations would still look like. We figured out when they had to be in the hospital, when they could do remote learning. But that was that innovation I think Tina was talking about. You know, we had to innovate, we had to change, we had to be thoughtful about how we could keep them making steady progress to a degree. They couldn't just shelter in place. They couldn't be, you know, isolated because they can't learn medicine that way. So one of our biggest challenges has been, how do we keep that moving? And so 2 years later, we have learners who have entered into the system in different places. We have some learners who've been like right in the thick of things since they began. We have new learners who started in September who were stunned that there are some things partially remote in January because they never had that experience before. So I think the key is medical students are just like anyone else. They're all adjusting to the changes that have to be in place. So we have mental health services, we have counselors, we have dedicated staff whose whole focus every morning is to look at the reports that are coming in from students who have symptoms and explaining to them, yes, you must be isolated. No, you can't, you must quarantine. No, you can't go to your clinical rotation today. We'll figure out how you're gonna make that time up later, but you still have to, you know, deal with those protocols. So we have put in place some systemic responses. But it's every day. It's not like, you know, we say you fill out your screening form like you brush your teeth. Brush your teeth, pull open your phone, fill out your screening form. Your screening form tells you whether or not you can be a part of the educational system for the day. And so it is a constant activity that, you know, many of our students, they don't like that. They want to stop. They want to say, well, you know, we did it Monday. We don't have to do it Friday. No, you have to do it 7 days a week. You have to do it all the time. And it has to be a part of your routine.
Thank you so much for that, Dr. Lipscomb. And Teresa, your question is more related to what's going on in the school system. So could you tell us about how the COVID pandemic has impacted the learning environment for students and the toll that it has had on parents, teachers, and administrators? So what are you hearing, and how is the educational community addressing some of those concerns?
Yeah, so I'm still deeply rooted in the educational community. But first, I want to just say that to teachers and parents, administrators, to the education community as a whole, support staff, they are to be commended. They turned this around, right? And it wasn't by themselves as a system, but they are with children 7 hours a day. They feed those kids twice a day. They're afraid. They are afraid. And yet they have to continue to keep this face on. So I want to start by just saying thank you to them for having these children every day, all day. There are over 100,000 children just in Kent County, 1.5 in the state of Michigan. And so imagine, it's not that these children rotate in and out as so many of our systems in the community. They do that. You're sick, you go to the hospital, you come home. No, they are there every single day, 5 days a week, right? And you have these people on the front line with these millions of children. And it is not easy. And this idea of this learning interrupted, which is the phrase that we're calling this, it is has seriously been interrupted. You have second graders who were in school just 5 months in kindergarten, and now they're in second grade. Imagine the gap that these teachers are trying to fill. Just learning how to do school. We all learned how to do school, right? That's a process. And so you have that on top of teachers and educators, support staff trying to be counselors, trying to fill in for folks, parents trusting their kids to go, in addition to, especially for poor children, Black and brown children, the learning, there was already a gap. And now they've been home for 2 years almost, right? And so how are we ever going to fix it? I think there's so many things that we as a community need to do for this learning interruption that has happened. But there are 7 to 10 months behind, we know, because of this pandemic. And that's on top of the gap that many of our children already had. For 9 through 12 or 8 through 12, there are an additional 4 million children struggling with chronic absenteeism. Additional children struggling with chronic absenteeism. So when we went virtual, when schools shut down, they shut down as well, right? And we know what happens. Incarceration rate goes up. This is just from 1 year being held back. Now we're saying we're 2 and 3 years behind. Incarceration rate goes up. The money that we're going to lose across the globe, trillions of dollars, we'll never recoup. I think that we don't know I know that the data is out for the long-term effect. We don't know what is going to happen, but we do know what fear does to the brain and how it reshapes. Mm-hmm. And so if you are dealing in trauma every single solitary day, which many of our children were already living in trauma, and now you add this on top of it, I think the learning loss is going to be high. I think it's going to take forever for us to figure this out. But we need to be innovative. We need to collaborate. We need to come together and not blame each other, right? This is where we are today. And how do we create solutions in order to fix this, to give children, young folks, an opportunity for a successful life? Because this is long-term. 40, 50 years from now, we will still feel the effects of this. And I think that it is incumbent on all of us to do all that we can. One of the things I do with Lead 616 in my coaching leadership is sometimes just being a thought partner, right? People are afraid and they know what to do. And especially those that have tons of people reporting to them, they can't show fear. And so you wonder what that's doing to them, right? And so being a thought partner, being a coach, a mentor, that's what people need, right? They don't always need an answer. Sometimes I just need you to listen and be okay with, I am afraid every single day. And I think that that's our role. And as educators, they're trying to figure it out. We teach superintendents. No one has lived through a pandemic before. You are the first. And so when people criticize you on what you should, would, and couldn't do, and we always have those folks that can sit on the sidelines and do that, we say to them, do what you know you need to do for children, staff, and families, right? And stick to the real work. You can't have all of the people from the bleachers telling you how to do your work. Try to stick to your core, do what you can, and keep those children safe. I just think that we all need to show grace and mercy, right? And not be so judgmental of people. This is hard. This is hard for all of you guys. I commend, all of the folks here on the call with us, especially, those of you that are still trying to make this work. I think we just need to just show a little more grace with each other and know that it has never been done and we're going to make mistakes, right? And we're going to lash out at each other, but we have to have forgiveness.
Thank you for that. Thank you for each of you. Just the feedback that you provided on this critical issue is so important to the community. And we have listeners here and viewers on Zoom, but we also have people out on Facebook Live as well as YouTube. And I'm sure that they are appreciating all the information and the experiences and support that you're providing in this conversation. So on behalf of all the listeners, I want to thank you. We do have also a question from a participant who wants to know, like, what are you doing to increase morale during the pandemic? So if you guys could answer that question. I'll just have one person answer that question. So whoever would like to jump in.
We're doing a lot of things to try to increase morale. I'd say communication, constant communication is really important, and to talk about the things that you know, and then also to address the things that you don't know, because we just have to get it out there and be transparent and be authentic about it. I think walking around and listening to what the concerns are and seeing if you can solve some of those issues that are coming up, but being honest about what you can and cannot do. And then it is, how can we come together and do some of the little things? We've put together volunteer activities where, because we've been short-staffed in some areas, we've actually gone and volunteered and done some of the work. And that sends a huge ripple throughout the organization when they see other people from other parts of the organization come in to help an area of need. And it really helps with this togetherness. I think overall, people are going to be happier when this is finally over, or we're on the other side and in this endemic. But it's the little things, back to I think what Christina said, just little things that you can do will raise the morale. And I also agree, giving grace is extremely important.
Thank you. Thank you. So I want to move into some questions about safety. And Teresa, I'll start with you on this one, because mask has been a real big controversial issue within most states and communities. So if you could talk about how we can create like a universal design process that speaks to like the universal audience of students to support their safety regarding masks.
Yeah, I think that's a great question. I've given this one a lot of thought just over the pandemic. I think that it's hard. It's unfortunate that we have polarized. We are so polarized around mask and safety. And I think it's just unfortunate. I do think that people have a right to make a decision, right, to allow their children to wear masks or not masks. But the thing is this, these children go to school every single day. And although you may have that right at home, when you are working in an environment with other folks, I think that it has to be extremely important. I think it has to be extremely important that people wear the mask. We work with staff so that they can protect children as well as protecting, the staff members. The other thing is this, when it comes down to the mask, the CDC has recommended, and I think they need to come out stronger, but that's just me. I think that children should wear masks in school because you have to protect the staff. If we want to get this country back up and running, the only way is we have to try to stop this pandemic. And the way to do that is by wearing the mask. Everyone's not going to be happy. I get that. I don't like wearing the mask either, but I want my grandchildren to be safe. I want my daughters to be safe. The other thing is this, the research is clear. In school districts where children and staff are wearing masks, they're 3 times less likely to get COVID. So I get you have a right. I understand that. But at the same time, in order for us to move this, you've got to wear masks. Those children need to wear masks. Teachers are tired. Principals are tired. They cannot continue. Merging classrooms, that doesn't work. You're putting now 40 kids in a classroom, or the teacher is out, or their chair. It's just, we're never going to get out of this unless we all come together as one, row in the same direction, even when we don't like it, right? It is the best thing to do. So I don't know how to do this universal design, but I'm a mother and a grandmother first. And I know how to take it. Right.
Thank you so much for that. And for Tina, Christina, and Dr. Lipscomb, This question is about processes and procedures. And so we're interested in what kind of protocols do you have in place to ensure an equitable, safe, and healthy environment for all of your employees, and how do you ensure compliance? And so if we can start with Christina Keller.
Sure. So I spoke a little bit about our wayfinders. So with Kenyatta and Sharon, they have been able to keep us up to speed on the multiple changing things, even as recent as last week with OSHA and the CDC and various different ones. So we work to ensure that all of our policies and procedures meet all of the regulatory environment needs, but we also have multiple different locations. So not only just Michigan, but Ohio, North Carolina, and Texas. And so keeping up to date on what are the different policies in the different locations and ensuring that we are adhering to those. I will say it's been a process. It's been a ongoing process that's been evolving. But what we start with is the idea that safety of our employees is the most important, and then also treating with dignity and respect. We had some decisions that we had to make pretty early on as an essential supplier of whether people were necessary in the office or not. And one of the things that we work really hard at is that we don't have a divide between what you call the carpet and the concrete. So if it's safe for humans, it's safe for humans. If it's not safe for humans, it's not safe for humans in my book. And so how do we make this safe for all people to be a part of the organization and moving it forward? So we've done a lot to work on disinfecting, hand sanitizing, mask wearing, and we also have a Ask Kenyatta confidential hotline where people can talk about issues that they might be having or things that they might see. One of the big things we've been working at for a number of years is our STOP observations, which is safety training observation programs, so that and we've been able to have world-class safety ratings because when you see something that's unsafe, you mention it and you recognize that, and then we can address things before they become issues. And so really creating an active work environment, not only on our policies and procedures, which we have, but also for active folks who are feeling engaged and able to raise concerns that they might have so that we can have that dialogue.
Thank you for that. Dr. Lipscomb.
So Michigan State has been, I think, on the front end of a lot of policies related to safety, very early on requiring masks wearing in indoor settings. That continues for us. There's always that conversation about how do you adjust being in an educational setting and having, large athletic events, right? So what has happened at the university level has stepped up higher since the fall. So now we go beyond simply mask wearing, but actually requiring documentation of vaccines or a negative test result to go into any of these very, very large settings. A basketball game, a hockey game. All of that trickles down to everyday things that you do with learners. So, the Secchia Center and the Grand Rapids Research Center and the Doug Meyer Center for Innovation, that is all Michigan State University. That's how you see us in Grand Rapids. And so all of those policies continue to be in place. We're having conversations with our student organizations about how to safely continue to volunteer in the community, provide community forums, do the outreach that you want to do, but you have to follow those guidelines that are in place. So I think from a university standpoint, we pretty much stood our ground. When mandatory vaccines and boosters, so as of February 1st, everyone has to be boosted. And the university took this very, very seriously. Anyone who was an employee, anyone who was a student who did not meet those guidelines in the fall are no longer students and no longer working at the university. And that's a very tough line to take. For the medical students, we were there before the university was. We required the vaccine before the university did, because we could not send our medical students into these healthcare environments and being a part of a team and have them not be protected for themselves, but also have them be in a situation where they could be harmful to patients. Because the focus of healthcare is the patient. It is not the learner who's in that environment. So I think that you'll see that there are going to be evolving things that happen, that this is not going to be a static state, that we will continue to add new policies and requirements and work to have the teeth to implement them. And I think the other thing I'll say is, you know, we're all a part of the community, right? Like, we can't act in an isolated way. And so often, you know, our younger learners, you know, kind of young adults, 20 to 30, they're so infallible, you know, nothing can ever happen to them. It's not going to impact them. And I think what we're seeing, certainly in the last 2 months, is that that population is beginning to be impacted in a way that they had not thought they would be impacted. And so then that helps them carry that message for all those policies and procedures. So none of us love masks, but you know, there are countries around the world who wear masks all the time. It is cultural to us. And so a part of what I think we're experiencing is this sort of cultural shift. And we're not like real good at that. We're much better at what we think we know. The last thing I'll say is not about that, but there was a question in the chat about, you know, how was COVID impacting applications to medical school? You know, we had 11,000 applications for 190 seats in our application process last year. Prior to that, our highest had been about 6,500. So we do know when things sort of go differently in the world that people begin to think about education. The piece that didn't change was the representation of the applicants. And so when we think about social determinants of health and we think about who are the populations who are being impacted by COVID and all the disparities, yes, lots of applications, but not necessarily the applications from those individuals who might help us close those gaps, help us, you know, provide services in those communities. And so I think that's the work in progress. And just to follow something Teresa said, we have a pathway to health professions, right? So in order for Tina to be able to hire her phlebotomist and her respiratory therapist and all the people that she's going to need to hire in 20 years, they are in the pathway now. And so it's really important for us to understand we have to care about losing 2 or 3 years of education for those who are most at risk, you know, because you will see that down the road. So looking for ways, and I know Grahi is doing this, how do we come together and we resource and we educate and we fill in the gap and we do the extra tutoring and we do the extra sort of reinforcement, because the future healthcare professionals of tomorrow are the ones who are in education today. They're not the medical students. They're not the nursing students today. They are the folks who are in 6th grade and 7th grade and kindergarten. And so that kind of pathway thought process in a community like Grand Rapids, which is so progressive, always thinking in advance. That's something that I think the offshoot of a panel like this are those kinds of conversations that we can have, because the future care of the community is already being developed as people sort of go through the pathway. Sorry, I sort of went all around, but it seemed all connected in my head.
That was fantastic. So thank you so much. But I'm going to shift this question, and I'll just ask Tina this question. It's a question regarding equity. And what we're interested in is what are some of the challenges that you're seeing regarding equity in the workplace, particularly around the fact that people are kind of opting out, wanting to retire early. We're hearing often that people are tired. They're interested in, like reducing their lifestyle and minimizing because of the kinds of challenges in health issues that they have experienced due to COVID. And so looking at some of those shifts in the workplace, and how are you looking at like equitable kinds of processes as you're looking for new employees and so forth?
A great question. And it goes back to the pathways that Wanda just mentioned. We want people to be curious about healthcare professions from, birth. And, when you think about healthcare, it's a small city. We have 30,000 people that work at Spectrum Health. And it's not just nurses or doctors. There's a ton of roles that people can be part of, and we'd love to show the opportunities to people if they're interested. As it relates to hiring talented people, we are very focused on equity and inclusion and diversity. We've modified our practices over the last few years to ensure that when we're hiring, that we've changed some of the hiring processes. We've changed we've done panel interviews now. It's a requirement for panel interviews. There's requirements to make sure that all the pools have diverse candidates in them. I think some of the concerns we have are how will we help with childcare? What's going to do? Because we've seen women in particular leave the workforce. So what can we do to get more women back into the profession? Can we think about different ways to have the shift schedules? Should it be different times? Should it be different days? Is there a way to structure that so that the family can work around those areas? We have invested in additional training and tried to figure out how to bring more laptops to the department so that people can actually look for the next job that they want to do, a promotion within Spectrum Health, and have the training and skills to then apply for that and not have to figure out where do I go to get a computer, and then how do I try to get the bus if I need to get the computer, and all those various elements there. So there's a lot of emphasis on what we're trying to do in terms of hiring talented people from our communities. One other thing I'll mention is that we are reframing the job descriptions because we want to make sure that we are really thoughtful about what is required of the job description to make sure that we are attracting talent from our community. We know we have the talent here and we want to hire you. If you love taking care of people, if you love our mission to improve health, inspire hope, and save lives, and you love our values of compassion, of collaboration, of curiosity and courage, apply. We are excited to have you join our organization, and the reward that you get from helping others in our community is amazing. And so I'd encourage you to take a chance on us.
Thank you. Okay, all of you job seekers out there, take a look at what Spectrum Health is offering. So, so we will definitely get that word out, amplify that, Christina. So thank you so much for that. I do want to get into the last question, and I know that we're running a little bit out of time, but I do ask if people could stay on for this last question. And it's important because there are over 800,000, like nearly 1 million people who have died in this country from COVID. And when we think about that number, that is more than the entire county of Kent. And as we think about like who have been impacted, the ways we have been impacted, there's not a person in this country or world who've not been impacted by COVID. And so we are working, like as many of you, each of you, the panelists have indicated, that people are working tirelessly and just sacrificially to provide the care and the support needed to end this pandemic. So the last question for each of the panelists, and I'd love to hear from each of you on what words of advice would you give to people who are still hesitant to get vaccinated? And so Teresa, if we could start with you, please.
Thank you. I think that for people to know that together we can and we'll get through this. We will get to the other side. And in doing so, we don't want to lose our loved ones. And the only way to prevent that is for us to get vaccinated. We have to get our boosters. We have to do everything we can to stop this virus. We can't say, well, 98% of the people will live. We don't know the long-term effects. What we do know is you have a greater chance of survival if, in fact, you have been vaccinated. We need to listen to the science. We have to trust our doctors, our physicians. And when we say we don't know what's in this, we don't know what's in Tylenol. We don't know what's in coffee, a lot of stuff we don't know what's in, right? We have to listen to the scientists on this one in order for us to get through it. And with that, I just say, please, everyone, follow the CDC, wash your hands, stay masked up, right? Just some things, but most importantly, we have to get the vaccine.
Christina?
I think we're going to have a lot of things that we have to work together as a community moving forward, addressing housing stability, childcare, educational outcomes when some kids were home and their parents were at work and some parents were at home and their kids were at school. I mean, there's a lot of things that we have to come together as, and this is a small thing that we can all come together as a community and say, you know what, at a minimum, let's all get vaccinated and boosted. And that's something that's the start of a coming together as a community. And I know that from my perspective, I want to do whatever I can to keep my family safe using the latest and greatest technology available to us. And I think that that's something that many of us in our community hopefully are thinking as well of what can we do as that first step towards coming together as a community.
Thank you. Dr. Liscombe.
I'd like to just underscore the word grace, compassion. We are a community, and taking the step to be vaccinated and to be boosted, you do this for yourself, you do it for others, you do it for the people that you love. You do it so we can move forward as a community. Children receive vaccinations really early in life, and they're a part of our life here. So anything that you can do to help those close to you in your circle be safe and be healthy and have a healthy response to something that is not the most positive, we hope you will do that.
Thank you so much. And Tina?
I would say all of our focus is we want a healthier community and we want you to be healthy. And getting the vaccine is one way that you stay out of the hospital, that you have less long COVID issues or less issues, and it just keeps you healthier. Yeah, I would much prefer that you were healthier versus sick. I would much prefer empty beds in our hospital than full ones. And our whole job is to help you be healthier. And we need to make sure we're partnering together on that, for as a community, we can trust each other and we can build that health. Because when we are healthier, we lead better lives, we're more productive, we're a more engaged community, and everyone benefits from that.
Thank you all so much. And unfortunately, it's time for us to bring this event to a close. And I just want to end by thanking our panel of dynamic leaders for joining us today. And if we were in person, we would give you a round of applause. And I see the people have that hand clap up there, but thank you all so much. And your presence here is just another display of the commitment you have to serving our great community. And we are grateful for you and the teams that you represent. Those who show up, as you've talked about, when they don't have anything more to give and to serve the needs of all of us. So thank you. I want to thank our board, Paul Doyle, chair, and other board members I see on the call. Thank you guys so much for joining in and supporting and assisting in planning this event. And but most importantly, to those who tune in to listen to this conversation. And we hope that it sparks continued discussion, which we plan to have in your homes and in your professional circles. So coming together is the only way we'll get through these challenging times And I'm inspired by those who are rising to the challenge. And we are encouraged, or we encourage you to stay safe by social distancing, keeping your hands cleaned and sanitized. And as everyone has indicated on the panel, please get vaccinated. So from all of us here at Graha, thank you for joining us and have a wonderful day. Also stay tuned, visit our website because we have lots of things going on this year. It is our 20th anniversary and we will celebrate big and want you to celebrate with us. So thank you and have a wonderful day.